Channel 3 News, your #1 choice for the latest in epidemiological news. Our top story for today is alcohol consumption and pregnancy. There has always been controversy over this issue, and many doctors have told patients that an occasional drink during pregnancy was safe. However, in October of this year, the American Academy of Pediatrics released a statement that no amount of alcohol should be considered safe during any trimester of pregnancy. They identified prenatal exposure to alcohol as being the leading cause of preventable birth defects, as well as later cognitive problems. In surveys, about half of all childbearing age women in the United States report consuming alcohol within the past month, and about 8% of women say that they continued to consume alcohol during their pregnancy. The American Academy of Pediatrics says that every woman and baby will react differently to different amounts of alcohol, so the safest thing is for women to abstain from alcohol completely during their pregnancy. In regards to this issue, a new case control study is being developed to test the hypothesis that even minimal amounts of alcohol consumption during pregnancy results in an increased risk of preterm labor. They chose a case control study because an experimental study would have been unethical, and because this allows them to investigate multiple exposures or risk factors for premature birth. Before we look at this particular study, let's review the characteristics of case control studies. They are observational studies, so unlike experimental studies, the exposure is not assigned by the investigator. This allows for the study of harmful exposures, which would be unethical in an experimental study. In a case control study, the disease is identified first. These would be the cases. And then the controls, the people without the disease, are also chosen. Both of these groups are chosen from the same source population. Once the cases and controls are identified, then the exposure is recalled by the participants. This can be in the form of questionnaire or interviews. There is no follow-up in a case control study, and another benefit is that they are relatively inexpensive and not as time-consuming as experimental or cohort studies. Now to Daniella, who is at Cal State Northridge, where the study is being conducted, for more details.
Thanks, Natalie. So, how do we select the population? During 2016, both cases and controls will be selected from several different hospitals in the Southern California area. One control will be selected for each case from the same hospital. The study is looking to review 500 cases and 500 controls within 2016. Eligible cases are defined as women giving birth to singleton babies at 37 weeks gestation or less. Controls are women giving birth to singleton babies at 38 weeks gestation or more. Exposure and frequency. Selected cases and controls will be asked to complete a questionnaire. Questionnaires are sent to women after giving birth and asked about health-related behaviors and events before, during, and after their pregnancy, including alcohol consumption. Some of these questions will include, during your pregnancy, how many alcoholic beverages did you drink each week? Some of the options will be 0, 1 to 4, 5 to 7, and 8 or more. The 1 to 7 range will be a case because it is considered minimal drinking. And some other questions will include, did you smoke during your pregnancy? And some other health-related behaviors. An unexposed group will be those who do not consume any alcohol during pregnancy. And now back to Natalie in the newsroom.
Thank you, Daniella. Just one question. Do you know of any biases or limitations to this study?
Thanks, Natalie. That's a great question. Some of the potential biases for this case control study are limitation bias. Some women may not remember their exposure or alcohol consumption. Another bias would be recall bias, because those who had preterm babies may remember more potential exposures than someone who had a full-term pregnancy.
Excellent. And for those who are interested, all participants will be provided with free diapers for a year. Thank you for joining us. We'll be right back after this commercial break.
Attention! Are you pregnant or planning to become pregnant in the next year? You may be eligible to participate in a case control study. Simply fill out a questionnaire and you'll get free diapers for a year. Eligibility requirements. Women giving birth to singleton babies. Southern California hospital births. Study details. Outcome of interest, preterm birth. Exposure, limited alcohol consumption, 1 to 7 drinks per week. Case, premature birth. Control, full-term birth. For more information, contact the CSUN Public Health Department.
Welcome back, and thank you for joining us this evening. Be sure to tune in next time for a special on Ebola prevention efforts. Until then, Daniella Spadafora and I thank you for watching Channel 3 Epidemiology News.